Hello, members of the Association of Adolescent Health Professionals. My name is Ross Gallagher. I'm providing a presentation entitled Information Behaviors of Adolescents Seeking Health-Related Information. Through this presentation, we will analyze the information-seeking behaviors of adolescents in search of health-related information, with a particular emphasis on the strategies employed by adolescents to acquire that information, along with the methods they use. To begin, the research is well documented on the mental health outcomes of adolescents, especially in this age of social media and access to the internet. This has become an issue for adolescents' health and the information that they seek. The research identifies two challenges or obstacles to adolescents' information seeking behaviors. First, technology. Adolescents have become very dependent on this use to acquire the information that they seek. The vast and complex nature of Internet's information ecosystem presents significant navigation challenges, particularly for young adolescents who lack a comprehensive understanding of how to find quality information. Furthermore, adolescents tend to rely more heavily on their peers or through anonymous means than on health professionals when seeking health-related information. The research has shown that this is driven by the desire for privacy, right, and anonymity. Adolescents prefer that level of privacy from outsider groups and can find that online. Both these obstacles are interrelated and can perpetuate each other. To better understand the interconnectedness between the technology and information behaviors of adolescents, we'll examine them through two theories. First, information poverty, with the focuses of insider and outsider and secrecy and deception principles proposed by Chatham, and also on the concepts of principle of least effort. Right? Principle of least effort suggests that people tend to choose methods that require the least effort to achieve their goals or complete their tasks. With personal devices such as smartphones, searching for information becomes very easy. Adolescents and smartphones typically begin and conduct most of their information searches on those devices. Other ways to access online information, such as computers, are also more convenient than getting information from health professionals or other sources, such as your local library. Technology offers the least resistance path to accessing this information. However, finding quality information and utilizing search engines or databases can be challenging when seeking the best information. This makes the search more difficult. So, to make it easier and follow principle of least effort, adolescents often will rely on their peers in help gathering the information they're looking for. This usually occurs through chat groups, online forums, within some form of question-answer format. This method is simpler than doing the research themselves. Both of these methods support concepts of least effort. Second, Chatham's principle of information poverty suggests that when people lack knowledge about how to seek information, they become more dependent on their social or insider groups. This also suggests that insider groups will distrust members of any outsider group and attempt to conceal their information behaviors. When examining this diagram below, right, we can see that the individual starts at the center around the information poverty, with more associated closer groups near their inner circle within their separated communities, right? Then the broader groups, those outside, right, are less relied on through this group. So you see a heavier movement from community and individual than you would see from the general society and the individual. Community being more representative of that insider group. Okay. Unfortunately, health-related professionals may find themselves more towards the outside group. For adolescents, this group, the community or insider group, is usually amongst their peers, typically around their own age. And when it comes to adolescent information, they tend to turn to one another, fellow insiders with shared experiences. With smartphones, this group is easily accessible online, right? Through social media, chat groups, etc. This dynamic finds a certain level of privacy and anonymity within the online format. Okay. And again, the health-related professionals can find themselves more on the outside here in that societal group. So, how can members of the Association of Adolescent Health Professionals seek ways to better serve their users, group, and health-related information? Two research-backed approaches can be implemented. First, to better serve adolescent health-related professionals can promote a peer-to-peer sharing information. right? This is similar to patient-to-patient sharing examined in many studies. While conversations with health professionals focus on general medical topics, discussions with peer patients or those experiencing similar health concerns include more personal subjects and were more satisfying to the user. Additionally, although research has shown that information exchange between peer patients versus health professionals may be of lower quality, any information shared within the format of peer-to-peer complements that of the objectives of health professionals. This can also be delivered through various online channels, including social media platforms, chat groups, and online forums. It addresses such issues as minimal effort, getting where students access the information online, and relying on others to gather information instead of conducting the searches personally. The second approach involves supporting media literacy, right? This can be done through schools or other educational settings. The more adolescents are trained to search for quality information online, the more confident they will become. Research shows that teaching adolescent online literacy skills boosts confidence and improves search results. As the confidence increases, it reduces the reliance on unreliable sources and encourages them to trust their own judgment rather than utilizing their peers. Tests have shown that students who haven't received information literacy training tend to use more unreliable websites and score lower in their confidence in seeking information online, as shown through the EELS assessment. Okay. After participating on those online workshops, students use more reliable websites to find health information and show greater confidence in their search skills, right? So they're more likely decreasing their information poverty, and now are able to be confident in looking for that information and relying on their search methods. Okay. The greater the impact, the more in depth that kind of instruction will be for information and online literacy. So it is crucial to find effective ways to distribute health-related information to adolescents. Utilizing online platforms, which are preferred by adolescents, allows them to engage to peer-to-peer communication with support from health experts, aligning with their social norms and offering secrecy or anonymity. Additionally, supporting educational programs for schools or other institutions, such as your public library, can help reduce information gaps among adolescents, boosting their confidence in finding higher quality information and driving them to actually seek it themselves than relying on peers. Both approaches will better serve adolescents and enable adolescent health professionals to deliver relevant health information. Thank you for listening.